and welcome to another episode of Texas Best Docs. I'm your host, Kalee Pair, and today we have an enlightening episode focused on ensuring quality, transparency, and accountability in healthcare. We're shining the spotlight on one of the most outstanding orthopedic surgeons in Texas, Dr. Adam Wright. Born and raised in Texas, Dr. Wright has an impressive educational background and is board certified by the American Board of Orthopedic Surgery and specializes in hip and knee replacement surgeries. He utilizes state-of-the-art techniques, including Mako robotic-assisted surgery, custom implants, and minimally invasive methods, allowing patients to go home the same day. Dr. Wright, welcome to Texas Vet Stocks. Thanks for coming here.
Thank you for having me. What an impressive introduction. Thank you.
Yeah, well, you're awesome, and I know a lot about you, but for our listeners and viewers at home, let's start off by getting to know you a little bit. Tell us a little bit about yourself and your journey to becoming a doctor.
Sure. So I grew up in San Antonio, born and raised in Texas. My whole family's been here. I'm the oldest of four boys. My third brother had a lot of medical problems, cerebral palsy, lots of issues, and so that involved a lot of care and a lot of contact with the medical system. I was already interested in medicine, so that gave me an opportunity to meet doctors and learn about pathology, and for sure I knew I wanted to be a doctor. I wasn't sure what type until I got into college, and then I realized orthopedics would probably be the right fit for me, but you kind of see all aspects of it during training.
How did you know that it would be the right fit? So was there like an aha moment, or was it kind of just like...
I liked hanging out with the other orthopedic surgeons. I like the patients. Patients are motivated. They want to get better. They come to you with a problem, and almost always you can fix it or make it better.
Yeah, that's cool. And then so once you decide to become an orthopedic surgeon, what's that journey like after that?
So 4 years of college, 4 years of medical school, 5 years of residency, and 1 year of fellowship.
I just got tired.
Yeah, I mean, I told my wife, she's going to have to support me and be a sugar mama for the first 10 years of our marriage, and then maybe once I get in my 30s, I'll be able to support us.
So, I mean, have you been in Texas the whole time? Have you been other spots?
We've been all over. So we actually met at Texas A&M, and that was where we did undergrad, and then we went to Houston at UT Houston's medical school. Residency was in Temple, Texas at Baylor Scott & White, and fellowship was the Lake Tahoe Arthroplasty Fellowship in Reno, Nevada. So a little bit of time outside Texas, and it was beautiful. Yeah,
and so what brought you back here then?
Family. Being around family, and Texas is a great place to be. It's home. It's home for both of us. She grew up in Dallas. I grew up in San Antonio. So we just looked for any place off of 35 close to both families as much as we could be.
And so where did you land then here in Texas?
We are in the Plano area, Castle Hills neighborhood. We love it. We're never leaving. This is a great place to be. I love my patients. I love being close to family. Wonderful place.
So how long now have you been practicing here in the Plano area?
I've been here since 2020.
2020?
Which is a very rough time to move back and start a practice.
Yeah.
And, nobody knows who you are, and my practice specifically focuses on older patients who weren't getting out.
Yeah. I didn't even think about it like that. That's pretty interesting.
Unless you knew somebody, it's hard to figure out where to go. How do you find a doctor? How do you know if you have a good doctor? And so, Google reviews, talking to friends, that's kind of how most people will make contact with the medical system at this point.
And that's really what Texas Best Docs is here to kind of help with, because I think now more than ever post-COVID, people, are living far away from their families, or they're moving to different locations, and you don't know where you're going. You just kind of search, okay, I need my hip to be figured out. And whatever comes up on Google, you're not really researching anything else. So
well, and we run into that too. My family's still back in San Antonio. So when I'm trying to recommend doctors if they lived here, I have a huge network of people I know personally. Mm-hmm. But out there, I want to make sure that they're actually going to someone who's competent, but who I know is doing the right things ethically and has been a good provider the entire time they've been out.
I have a question. How many hip and knee surgeries do you do a year?
I do between 300 and 400 hip and knee replacements every year. The average orthopedic surgeon does 8. So just for reference.
And there you go, folks. Yeah, that is pretty amazing. So it's important to ask that, because, I would never even have known that. And that kind of sets you apart, I feel like, in a big way.
I had 6 today. So
yeah,
it's good to go to somebody who they know what they're doing. They're not scared of the hard cases that come their way because they've seen it before.
Mm-hmm.